Welcome guys to Ahmed Academy. Today we'll be covering the four main muscles of mastication with insight into their origin, insertion, action, nerve supply, and a few small tips on how to remember each one. So number one is the masseter muscle, which divides into two parts, the superficial part and the deep part. The superficial part originates from the lower border of the zygomatic bone and the anterior lower border of the zygomatic arch and inserts into the inferior surface of the ramus of the mandible. Moving on into the deep part, it originates from the lower border of the zygomatic arch and inserts into the superior surface of the ramus of the mandible. Action of this muscle is elevation of the mandible and adduction of the mandible upon movement away from the midline and bringing it back into the midline. And the nerve supply to the muscle comes from the masseteric nerve, which is a division of the mandibular nerve, coming from the anterior trunk. Moving on to number two is the temporalis muscle, which originates from the temporal fossa and deep temporal fascia and inserts into the coronoid process of the mandible. One way I remember its insertion, I've always thought to myself that the temporalis is the corona inserting into the coronoid process. I know it doesn't make sense, but if you just think that the temporalis is the corona, then I don't think you'll forget that inserts into the coronoid process. The action of the temporalis muscle is elevation and retraction of the mandible. So if you retract your mandible yourself and palpate near your ear where your temporalis actually is, you can feel your temporalis contracting. Moving on to the nerve supply to the temporalis, it comes from the deep temporal nerve, which is also a division of the mandibular nerve, specifically the anterior trunk. Number three is the medial pterygoid, which divides into two parts, the superficial head and the deep head. The superficial head originates from the maxillary tuberosity and pyramidal process of palatine bone, and the deep head originates from the medial surface of the lateral pterygoid plate. Both of these heads insert into the medial surface of the ramus of the mandible, partly inserting into the angle as well. Moving on to the action of the medial pterygoid, it elevates the mandible and helps in side-to-side movement, and its nerve supply comes from the main trunk of the mandibular nerve. The specific nerve is nerve to medial pterygoid. And finally, number four is the lateral pterygoid muscle, which divides into two parts, the superior part and the inferior part. The superior part originates from the greater wing of sphenoid. The inferior part originates from the lateral surface of the lateral pterygoid plate. They both insert into the anterior surface of the mandibular condyle, which is faded on this model just to help you see the muscle more clearly, but if you look closely, they both converge together and insert into the mandibular condyle. This is the only muscle that help depress the mandible, so opening of the jaw. Its nerve supply comes from the nerve to lateral pterygoid, which comes from the anterior division of the mandibular nerve. So regarding its inferior head, I always remember its origin being from the lateral surface of the lateral pterygoid. So lateral pterygoid originating from the lateral surface of the lateral pterygoid, so lateral cubed. Overall, within any of these muscles, the more context you build knowledge around them, the easier it makes to remember each one. So I hope this video helped you guys in remembering each one, and if you guys have any tips on how to remember the origins or insertion or any detail about these muscles, then please leave them in the comments below. And if you're a student, then we have amazing videos coming up for you guys, so I hope you guys press that like button and subscribe as well for more videos in the future. Good luck with everything, and once again, I hope this video helped. Thank you for watching.